So I am Helene Bader. I'm the founder and president of the Leptomeningeal Cancer Foundation, and I'm also a mom. My son Theo had leptomeningeal cancer, or LMD, or leptomeningeal metastasis, however you want to say it, and he passed away 2 years ago at the age of 17. And when we were taking care of Theo, my husband and I felt just so alone. Even with doctors who were doing their best to help us, we just didn't always feel like we had control over his symptoms. We had good weeks and bad weeks, good days and bad days, in all honesty, good hours and bad hours. We just weren't sure how to handle the stress and anxiety around the diagnosis and around his care. And we found ourselves at some point needing medical equipment like a shower chair and a bedside commode, and we just didn't even know where to begin to start getting these items. And as his disease progressed, we just found ourselves struggling so much with other issues that came up that they were sending us to the hospital, like a bed sore that just seemed to come out of nowhere or a urinary tract infection. And we later found out that there were better ways that we could have handled this at home and kept him out of the hospital. But how? How can life be easier and better for you when you're going through all of this? So I know we've all heard of home health care, we've all heard of palliative care, hospice care, but what do these words mean and what can truly help you live a better life when you're diagnosed with leptomeningeal disease? And one of the words that terrified us was palliative care. We were scared of it. We fought it. We just didn't understand it. We thought it meant end of life and giving up, and we were not going to do that. What we didn't understand was that palliative care isn't end of life care. It's supportive care. It's comfort care. You can go off of palliative care if your treatment is working and you don't need it anymore. It can just help in so many ways we didn't know about for anyone with cancer, a serious illness, for LMD. And now that I learned all these things, I just didn't know when Theo was sick. I'm really wanting to share it with everyone else so you can be better supported and focus on your person and your treatment and yourself. So today, I'd like to reintroduce palliative care to you just to help you get the support you need so you don't make the mistakes we made. And please don't run away. Stay with the conversation, ask the questions, just try to be open to this because I know the word is scarier than really what it can offer. So with us today are three experts in this area. First, I'd like to welcome Valentina Alex Chadwick. Alex is a palliative care nurse practitioner and the lead advanced practice provider for outpatient palliative medicine at Stanford Healthcare. They earned their advanced practice degree as an adult gerontology acute care nurse practitioner at University of California, San Francisco, and are an advanced certified hospice and palliative nurse. They provide outpatient care in the Palo Alto and Emeryville palliative care clinics. Welcome, Alex. Next, I'd like to welcome Megan Gershon. Megan is a clinical nurse for the Stanford Neuro-Oncology team. She works with a multidisciplinary team to coordinate care for patients with primary brain tumors, CNS metastases, and other neurological complications of cancer. She was also the caregiver for her father-in-law who had lung cancer and LMD. Welcome, Megan. And finally, we have with us Dr. Grant Smith. Dr. Smith is a palliative care physician and clinical associate professor of medicine at the Stanford School of Medicine. He also is the medical director of the Stanford Serious Illness Community Partnerships team. Dr. Smith received his medical degree from Harvard Medical School and completed his residency in internal medicine and fellowship in hospice and palliative medicine at University of California, San Francisco. As part of the Stanford faculty, he is an attending physician on the palliative care inpatient service and in the outpatient palliative care clinic in Palo Alto. Welcome, Grant. So we're going to get started actually by sharing a short video with you from Larry Gershon, Megan's father-in-law, about his experience at Stanford with the palliative care team.
The best thing about palliative care for me, and I think for every patient, is you have an objective, supportive team that is there to help you live through your cancer. Your oncologist treats the cancer, has your best interest all the time, but there are issues that are a result of that treatment that you need help with, and that's what palliative care has really done for me. My name's Larry Gershon. I'm 75 years old. I love being outdoors. I love being with family and friends. I love traveling and reading. I had a really bad cold. And frequently throughout my life, when I have a bad cold, it went into asthma symptoms. I went into urgent care at a local health facility and got treatment for the asthma symptoms. And before I left that appointment, the urgent care doctor said, I want to do an x-ray to make sure you don't have pneumonia. And the next day I got a call, and fortunately I didn't have pneumonia, but I did have a spot on my upper right lung. And diagnosis was stage 4 lung cancer. It was shocking, it was disturbing, it was unsettling. I knew about palliative care. I was a little resistant initially, but I also knew that palliative care was very beneficial for lung cancer or any kind of cancer patient. So I stuck it out, and soon it became apparent to me that my life was better with palliative care. Going through 10 years of life with any type of cancer disease has its inherent challenges, and I think over time I didn't really realize the stress that was happening, and palliative care initially was really beneficial to me to help balance that life and existing with cancer. It helped me normalize my dealing with cancer, to be able to focus on cancer when I needed to, and the rest of the time enjoy life to the fullest. The palliative care team helped me talk through treatment on several occasions. I had new cancer on several scans during the last 3 years, and until recently I chose to deal with those by radiating them. And palliative care helped me talk through that decision process, feel comfortable with it, understand what it meant to do that, and what it would and wouldn't do for me. But it helped me talk through that process and be comfortable with my decision. I'd like to share with anyone who doesn't know or doesn't want to know or doesn't want help from palliative care that it's a real benefit. Patients may not realize they need it, but and they may be afraid to go to palliative care because they have a preconception about the stigma of end of life. But palliative care is so much more than that. It really helps a person live in a very difficult situation.
So we all felt Larry's video really just shows us how much palliative care made a difference in his journey and was really just a good way to open the webinar. So we also, before we start, we wanted to do a quick poll. This will be anonymous, but it just is helpful for a discussion. So if we could bring up the first poll. So this is just receiving palliative care. So I am, or the person I'm caring for is receiving palliative care. I am, or the person I'm caring for is not receiving palliative care, or I'm not sure. So just be good to see if you could just answer, and then we'll just show results. I'll give everyone a few seconds. Okay. All right, do we have some responses that are in that we can show? Okay, so that's interesting. So we have a pretty perfect split there. I am receiving 44%, I am not 44%, and I'm not sure. All right. Well, that's really helpful just to get into our discussion. Grant, I wanted to start with you because we know palliative is a scary word for people. So can you tell us what it really means and how would you define it?
Definitely. And just want to thank you again, Helene, for inviting us. And thank you to Larry for sharing his story. I think he did a really good job of getting us started in this discussion about what palliative care is and what it can do. But just to try to provide our best definition of palliative care, we think of it as specialized healthcare that's really designed for people who are living with a serious or a difficult illness. And that includes diagnoses like cancer, dementia, other kind of organs that might be seriously injured or not working properly, like the heart, liver, or lungs. And palliative care is really focused on relief from both the physical symptoms, but also, as you, Helene, and Larry described, on the stress of an illness and dealing with how to cope with an illness. And our goal is really to improve quality of life, both for the individual with the diagnosis and for their loved ones, their family, their caregivers, their friends. So we really see the um, person that we're caring for is not just the individual, but their kind of system that surrounds them. And again, that focus or that goal to improve quality of life, I actually really like the way that Larry said it. It's to enjoy life to the fullest, make things as good as they possibly can be while this other thing is also happening. And palliative care is provided by a specially trained team. So it's an interdisciplinary team of doctors, nurses, social workers, spiritual care providers that work together with the person's other medical providers and their other team members. And it's really provided as an extra, and often we think essential, but definitely extra layer of support to the supports and team members someone already has. And I'll kind of wrap up the definition by maybe one of the most important take-home points I hope people go home with today. And that's really that palliative care and getting palliative care is based on the needs of the individual and not on a specific prognosis. So we often say that palliative care can really be appropriate at any age and at any stage of one of these difficult or serious illness. And it even can sometimes be provided along curative treatments. So that's a way that it's really unique and it is broad and can be for a large group of people. So I hope that helps kind of get us started in thinking about what palliative care is.
Yeah, absolutely. No, thank you for that definition. And just to add a little bit more to that, Alex, I'm just curious how you can talk about palliative care being different from the other medical services you get and who is part of the palliative care team, who makes up that team.
Yeah, I want to thank you for inviting me. I'm very happy to be here. Um, this is a great question. So I think that unlike specialists who are focused on curing and managing a specific disease, the palliative care focus, our focus is on improving your quality of life by managing physical symptoms from the disease or the treatment and reducing stress. The reason we are able to care for all those different types of diseases is because we are focused beyond the disease. We are focused on the whole person, mind, body, and spirit. And in order to care for a person as a whole and to support the people who love and care for that person as well, we bring a team of doctors, nurses, social workers, and spiritual care providers. The providers, which in our department are made up of advanced practice providers like nurse practitioners, and the physicians, they are focusing on prescribing medications, helping with medical decisions, and coordinating with other doctors. Our social workers are able to help with practical needs like financial concerns, resources that might be needed, but they are also providing emotional support for the patient and the caregivers. Finally, our spiritual care providers attend to the spirit by responding to distress and providing emotional support. And so it's really necessary that we have to look at all of those areas and consider you as a whole, that we have all of these different professionals that are focused on one goal, which is relieving suffering.
Yeah, that's wonderful to hear. It's really helpful to get a sense of who's on that team and that it's very different and complementary to the medical team that you have. Megan, I want to ask you a little bit more about Larry because we saw this great video and you were one of Larry's caregivers. Did you help him make the decision to ask for palliative care? And can you share a little bit more how it helped him?
Sure. So again, thanks for having us and for sharing my father-in-law's video. Um, was a great way to honor his legacy and knowing that palliative care was such an important part of his journey. Um, he was diagnosed almost 13 years before he passed away with stage 4 lung cancer. And so I really feel like I had the opportunity to watch him kind of grow and glow through this diagnosis in a way that nobody expected. I remember in the very beginning going on a walk with him, and he was just like, I just want it all to, can we just cut it out? Can we cut it all out and just throw it away, throw it into space, do whatever? And trying to explain to him that unfortunately that wasn't going to be an option, but that there are other ways to live his best life with this cancer. And so he kind of really dug in looking for ways to have a sense of control. And there were so many varying parts of his journey where things, kind of people forgot about his cancer. He didn't, obviously, but maybe others did. And but he didn't. His thing was he didn't want to feel like he was being treated as differently because he had cancer. And so he needed some place where he could bring those difficulties and share it with somebody else. And that's what palliative care really provided for him, was the opportunity to have a confident and Alex really kind of helped him just come to certain decisions that were hard along the way when there was time to make different treatment decisions. It was a safe space for him to feel like he could complain or be angry or mad or sad, and not put that burden on those around him, as well as taking on some of those same burdens for us and my mother-in-law primarily, and being able to kind of direct him back to somebody that, hey, why don't you talk to palliative care about this? Maybe they have some ideas on why you're feeling so moody, or maybe they can explain to my mother-in-law why she's feeling that way. And we did start it early on, and it was very helpful to know that he had that place to go to ask those questions.
Yeah, that's a great way to start it, obviously. And I think what you said really resonated with me, and I hope with others too, is it gave him a sense of control, because you have no control over so many parts of your disease and your illness. So at least to find somewhere where you can control things is really important. You mentioned Alex as being one of the palliative care nurses for Larry. And Alex, I'd love to hear how you helped Larry with medical decision making and other aspects of care.
Yeah. One of Larry's means of having control was being really well informed. He taught me a lot, actually. And I think it's important to know that the individual relationship with the palliative care provider is going to look completely different for everyone. It is really not, it's not, you don't have to be as informed as Larry was, but that was the basis of his coping. He was also very involved in the Go to Lung Foundation, and he was a phone buddy, which essentially meant that he was providing palliative care to peers. So we actually spent a lot of our discussions talking about what that was like. He was very brave because he was seeing every possible version of how his disease would progress and facing that. And I think when you are witnessing other people go through a process that you would not want for yourself, it makes you get real serious about making sure the people who are around you understand what your wishes would be. And so I think with every new sign of disease progression, he and I would go back and have a discussion about, okay, well, what are the treatment options? What is the line in the sand for you? If I'm going to try, for instance, it might be I'm going to try this X treatment, and if this thing happens, that's the line for me, then I would want to stop. We were always checking in that way. I think the other way in which we uh, talked about medical decision makings, or the way that I supported him outside of actual symptoms, was the strain that occurred between him and his wife. They were both worried about each other. She would often show up to the beginning of the visit and, give me her perspective of what she was worried about in that moment, and also what she was feeling, or if when things were getting difficult, she would share with me, I am struggling. And so we were able to have those conversations, all three of us. And then we were also able to have the one-on-one conversations and figure out, okay, I'm going to offer this support. I'm going to connect her with one of our social workers to have a little extra. And that would relieve Larry so much to know that someone was attending to her too. There were not a lot of symptoms that we had to cover. In a normal situation, it's probably about 50-50. 50% of my time might be spent on managing symptoms, if not more. I was really more of a support for the medical decision making, and then helping them both to work through their worry for each other. They were both profoundly worried for each other, and I really just feel honored that I was able to care for them both.
Yeah, and I think that's really important to know, is that it's not just for the patient and it's not just for the caregiver, but it's for both. It's for everybody who's affected by this in that care team. Um, Grant, can you share a little bit more about like how palliative care works? I know that you talked to Alex about some of the benefits. Or is there like a list of benefits that people can get,
Mm.
especially for people with leptomeningeal metastases? Because I think there's specific things that you might be able to help with that people aren't aware of.
Yeah, thank you so much. What a great question. And thank you, Alex and Megan, for sharing your stories, because I think that in some ways highlights the benefits better than anything list I can give. But I do think that one of the things and one of the biggest benefits and things that palliative care has to offer is really what Alex was getting at. And it's this kind of like accompaniment and walking alongside someone in their journey. I know when we were preparing, we were talking about all the advancements of cancer therapies has been incredible, and it's also left like a lot more uncertainty about what the future will bring. And I think having a partner to walk alongside that uncertain future together can be really helpful. And in some ways, we can help to be maybe like a gentle guide and having a little bit of a lantern in the cave to say, well, this might be what's up ahead a bit. Let's look at this together and see what we think about it. So I think that's one of the way about like sort of how palliative care works. When I think about for leptomeningeal disease, we do know, and I think Alex described really well about some of that accompaniment and helping with planning and thinking about treatment options. When we think about some of the specific symptoms, we know that things like headache, nausea and vomiting, seizures, those are things that can present with leptomeningeal disease. And I think some of the sort of secret sauce, if you will, of palliative care is in our holistic approach. Let's just think about pain, for example, like a bad headache. Um, we know that some of pain is the signals our nerves send to our brain to say, hey, there's something going on. But in palliative care, we also acknowledge that, gosh, pain can also be really frightening. It can be something that signals, gosh, is my disease getting worse? And that's bringing up this other sort of stress. And I think in our specialty, we just kind of get that. We understand that, and we try to use that to think about our treatment plan. Yes, we need some medicines that are going to help tamp down those physical, what the nerves are sending to the brain pain. And let's think about what else can we do to try to help bring that level of anxiety down. Think about what can we do for kind of coping and support so that whatever component that's contributing to the suffering coming from that pain, that we reduce that. So I think that's part of kind of that secret sauce and how we can get some of the benefits. We know from big national studies for people living with cancer that palliative care helps people have better symptom control, that their caregivers feel more supported and have less issues with things like anxiety and depression, people tend to not need to go to the hospital as often. And in some studies, people actually sometimes live longer when they get palliative care support. And so there's kind of a lot of evidence base for some of the benefits that we can offer.
Yeah, I think that's really interesting how you talked about, really looking at the whole person and not just kind of that symptom. And I think about that a lot of how hard the symptoms are because you don't know if they are just stress, if they're a side effect of your medication, if they're tumor progression and what it means. So it's all of that. It's not just a headache, it's really
Yeah.
everything. Um, Before I get into my next question, I just want to make sure everyone's aware there is a Q&A button at the bottom of your screen. So please feel free to put in any questions that you have, and we will try to get to as many as we can during this session. Um, Megan, you mentioned that Larry started his journey with palliative care pretty much at the beginning. So I was going to ask, when should you ask for it, and how do you ask for it, especially if no one brings it up? Should you ask for it right at the beginning of your diagnosis? Should you wait until you feel a certain way? Can you share more about that?
Yeah, I think as Grant mentioned, it's kind of an individual uh, journey. I think it's always good to know that it's there. It never hurts to ask in the beginning, kind of like if you're, I don't know, preparing for a baby or a big trip, you want to know what all the resources are, right? Like you're not going to wait till the baby shows up to be like, oh, now what do I need? And um, how am I going to feed and do all the things that I need to do to be, be prepared. So how can I best be prepared? So some people don't like to be as prepared. They like to just take things as they come. They're not such big planners. Um, but maybe someone in the family would like to, meet with palliative care team and know that like, okay, when things get a little tricky or a little tough, that this is who I can go to. I've kind of already established this relationship. So that way you're not doing something um, when the wheels are kind of falling off, so to speak, and there's not such a sense of urgency. Um, it gives you somebody else that you can reach out to help ask for support, whether that's again emotional, socially, or hey, we're having trouble walking. Can we talk about maybe physical therapy and a wheelchair? What kind of things do I need? Um, and then the pain, and also a lot of patients that are diagnosed with cancer or LMD, maybe they've had it so long they have other chronic illnesses as well, such as diabetes, heart disease. And so sometimes you're trying to put together the safest plan to help manage their symptoms with all their other medications. And palliative care can really kind of, again, focus on that whole person and put all of that together, uh, as well as like we did for Larry, just exploring like, okay, what's the next treatment option? What's best for us at this point? There's some new progression here or there. Is there a new trial? Or should we do radiation? Should we just monitor for now? And in addition to getting the information from the specialists, the palliative care can kind of help remind you of, well, here's what your goals are, and this is what this treatment will look like, and that treatment. And so it kind of helps you maybe kind of pull all that information together and put it in one place and have somebody that can give you some of that objective information.
Yeah, that's really helpful. And you talked about some symptoms, and I am curious, Alex, I know we've talked about like pain and other things, but like, do you actually deal with like if you have nausea or if you have constipation, or is it everything? And where does that line come in where it's you helping versus going to your oncologist, or
Mm.
is that kind of a blurred line and you just figure it out as it comes up?
Well, it usually depends on, it depends is a good thing to say for all of everything. So we could start everything with it depends. But I would say, in general, for cancer patients, the most common symptoms are probably um, pain, nausea, anxiety, fatigue, constipation you can throw in there because of the medications are often causing that. With LMD, it is probably one of the diseases where we're more collaborative with the treating team than a lot of the other diseases. And that's because, the neuro-oncologist is really involved in managing the intracranial pressure or the brain swelling.
Mm-hmm.
So they may be involved in using medications to handle the swelling and seizures. And then we may be helping with, and so that will also reduce pain. It will reduce nausea. It's going to have a part in managing the symptoms. And then also, we might need to think out of the box when symptoms become more difficult to control. And so that's us as the extra layer of support, helping with the pain, helping with the nausea, helping with the fatigue. And I think it's important to know that the anxiety that comes along with the stress of these diseases also worsens your experience of the symptoms. And so that's another reason why having this, a full team to help with reducing that stress is going to improve your experience of those symptoms. So a lot of the times it's medications. It can be all different kinds of medications. It could be, straight ahead pain medication, but it also could be antidepressants that not only assist with the anxiety, but also have a component of handling specific types of pain. It could be just changes that we make, behavioral changes that we're making. And sometimes it's just the talking it through.
Yeah.
So, I think it's medications, it's using our multidisciplinary team to address anxiety, depression, and that's the bread and butter of it.
Okay. No, that helps. And it actually kind of leads into a question that just came from the audience that maybe Grant, you can answer this. Someone asked, does palliative care help children coping with a parent who has LMD? So my son is the patient and very concerned on how to prepare the kids age 9 and 12. So is that something you could help with?
Yeah, this is a great reason to potentially ask for some help from a palliative care team. And we certainly could talk through kind of what's going on with the child and how the parents are doing with coping with their illness. Sometimes in the reverse too, we work with a specialized social work team. We're lucky to have this resource at Stanford that helps actually kind of parents talk with their kids about their illnesses and could probably provide just some additional guidance about that crosstalk back and forth between parents and their children. So absolutely, I think that's something that would be on the table. And I think this also brings up too, maybe a question that might come up a little bit later, but there's also palliative care available in pediatrics too. So a pediatric palliative care team might help take care of the child with the diagnosis, and they would also provide the same support we're talking about to parents as well. Just like if we have an adult patient with a child, that child is part of the family care team for the parent. So we really see the whole family as the unit we need to provide support for.
So we have another question. Megan, I'd love to have you answer this. It's from someone whose mom was just diagnosed with LMD, and she's understandably feeling overwhelmed and scared and doesn't know where to begin. And she asks, how do I plan next steps for care and get help quickly since I know the disease moves fast? And also, does the hospital help set up palliative care, even if it's in home? And is it covered through insurance or are these private self-pay? So it's a few questions in one, but it's really how do I get started? And then where does it actually take place? And how do we make that happen?
Sure. So, all very good questions because it does happen things do progress very quickly with LMD. Usually, a lot of times they will end up in the hospital with symptoms. And there are nurse case managers in the hospital that will make sure that before that patient is discharged home, that they have everything that they need in the house so they can put in a referral to palliative care or to home health. Make sure that they have, the equipment that's recommended, whether that's walker, wheelchair, hospital bed, and other support services in the home. And the good news is that it is not private pay for palliative care. Insurance will cover it. And even if you have Medi-Cal, that's part of the new initiative now. Those services are covered because it is, as Grant mentioned, the benefit is keeping patients out of the hospital with emergent medical situations, and just being able to meet the goal where the patient's at, and where the family's at. And sometimes that means also being discharged to like a skilled nursing facility, acute rehab, depending on what is going on. And so you can have concurrent resources happening at the same time.
And just to clarify, Medi-Cal is the Medicaid for California, right? That's the Medicaid
That's
plan.
correct.
Okay, just wanted to
Yeah.
make sure. It's really helpful to hear this because for us, we had no idea. So we went to medical supply stores and Amazon and we purchased everything out of pocket and it's expensive. And
Very expensive.
I wish we had realized because we pretty much did everything on our own and found things on our own and it's not easy. So I really appreciate knowing that this is something palliative care could help with and give people those places to buy stuff, help them get it and help pay for it so it's not coming out of pocket. um, Alex, one more question from the audience, and you kind of answered this, but I just would like to talk about it a little bit more just so it's clear to people. So what if you're asymptomatic and you just don't feel ready to think about palliative care? You don't think it's part of your plan yet, but you do want help making decisions about treatment. What would you say to the person of what they should do next? Should they go for palliative care? Is that not really the first step? What do you think?
Well, I think if you're wanting help making medical decision makings, it's being asymptomatic is the perfect time to do that. Uh, I do wonder what I would ask that person if I had the opportunity. What makes them feel that they're not ready to think about it? Just, of course, from our perspective, we're thinking of palliative care as about letting go of suffering. And there's anxiety around having to make decisions. So allowing us to shoulder some of that weight is going to help you with that part of it. And it is far easier to make decisions about what is and what is not within your goals of care when you are not feeling your worst.
Mhm.
The making those medical decisions really requires that you self-interrogate, okay, well, what do I want for myself? We need to know how you define what reasonable quality of life is. And then from there, all the decisions come. So it can be done also when you're not feeling great. But I think we would all say that we really love it when people are engaged in palliative care early because it allows us, there's not the weight of, I am really feeling scared because now I have a lot of symptoms and I'm having to address really big issues when I'm not at my best. I will also say that with LMD specifically, there's a time component. There will be a time when you may not be able to make decisions for yourself. That's a reality. That's a reality for everyone. But if you have something in your brain, right, then we have to worry about that. So I always remind people that one of the best gifts you can give to the people who love you is being able to tell them what you would want for yourself if you couldn't speak for yourself.
That leads perfectly into the next question. Grant, I'm going to turn it to you, but we did have a question from our audience about advanced care planning. And I know that's part of the benefits that you discussed earlier and kind of sharing your plans or what you want for yourself, like you just said, Alex. And this person said, I'm very close with my adult children and my sister, who is an ICU nurse, and I've spoken to them honestly about what I want at the end of life. So, how important is it for me to have an advanced care plan? There's just so much information to fill out. And is this something you can help with?
Yeah, what a great question. And I'll briefly just say, as Alex described, yes, this is definitely something that palliative care can and would love to help out with. And it sounds like this question is a little bit asking about the value of like a written advanced healthcare plan, sometimes also known as an advanced directive, or some people know this as like a living will. And what I would just remind the audience is that the goal of these discussions, of that paperwork, is to ultimately make sure that you get the care and the care plan honors the goals and values that are most important to you. So, how we achieve that can be diverse, like all people are diverse. But what I would say is there are a few things that I would prioritize the most, many of which this person has already done. But the first is really identifying who you would want to be that surrogate decision maker for you in the event you couldn't make decisions for yourself. And often it helps to have like the single individual person that you really would trust to be even like a tiebreaker, kind of have the final say. The second thing is once you know who that person is, you got to talk to that person and let them know that they are your person. And really, they need to know what is core to you. What are those things that are most important? And I get this is like kind of a difficult conversation to have, but my advice would be, and what we actually think about when we're struggling through these decisions, is to start with actually the really happy things. What brings you joy? What makes your life have meaning and purpose and joy in it? That's a conversation I'd like to have with my loved ones. That's a good one. And that actually really gets at the core thing. So I think starting with those two things can really get you off on the right foot. A more in-depth conversation about like how those core values relate to things you would or wouldn't want to go through. That's kind of like a next step. And then, putting those on paper is, in some ways, in my mind, sort of the final step. Like really having that person who knows you, that's probably the most important thing. But a written advance directive is just like another tool to make sure you've kind of flushed out those conversations pretty well. And then for some people, a written advance directive actually can be pretty important. And I would say it's really important for people who anticipate that there might be conflict among people who are be helping to make decisions so that you write down, no, no, I want this person to be the person. And if you're a person, you're nervous that maybe they don't feel the same way you do. Like
Mhm.
they might want something different for themselves or want something different for you than what you actually want. Putting that down in writing just gives them something literally to hold on to when they're in that seat trying to help figure out what to do. So, it's kind of a spectrum of things that you can do. But I hope that gives some guidance on at least my single perspective, what I think is kind of the most important, and when doing the actual paperwork really could be pretty critical.
And so that's something I've learned too about palliative care is it really helps you stop and think what matters most, right? What's important to me. And sometimes we're thinking about it, but we're not expressing it. So I think that could really help having someone talk you through that and then how to communicate it back with your loved ones so that it's out there, people know, and then you, like you said, put it on paper. We have another question from the audience, and Megan, I'll turn this to you. So it currently feels like a lot of the providers already aren't communicating with each other about my loved one's LMD and sometimes disagree with each other. The neuro-oncologist, the medical oncologist, the primary care. Would introducing palliative care into the mix help navigate that or just add another voice to contend with?
I would say palliative care can greatly help navigate because they're going to communicate with all those providers. Say, we met with Miss Sally today, or I can just use my father-in-law, Mr. Gershon. Um, and here's what he's worried about. Here's what their goals are. Here's what's going on. Here's what we did because he was complaining of pain or nausea. And I saw your notes on kind of the next steps, but maybe they're not going to quite make it to that point. They're not there yet, and it's adding a lot of stress to them, and just kind of just being that voice of just reason again, just somebody just to kind of help pull it all together. and take that stress off of the patient and the family to say like, oh, I don't actually agree with what, this doctor wants to do. I want to do what this other doctor said. And so palliative care can kind of come in and just say, here's what they told us they wanted today. So that way they don't feel like that they're being the bad guy or upsetting the physician. That's something that I always found interesting, that my father-in-law and my mother-in-law were always worried about, oh, what if we want to switch doctors? And they did at some point. Are they going to be upset? Are they going to be mad? But palliative care can help them walk through, like, just really, it's your life and you have to do what's best for you.
Yeah, and I mean, I don't know if this is the right word, but almost I feel like kind of refereeing in a way of saying like, you tell me what's going on and we can help communicate that back of saying the patient's feeling confused by all the different opinions. So how can we help them to not feel as confused? Is that accurate?
Absolutely. Yeah. And sometimes the patient, just because they're hearing so much information, there's not necessarily a disagreement. They're just hearing all these different options, and they're just kind of not sure what what the provider is kind of really presenting to them, so they can kind of help pull it all together.
Yeah, and I think with LMD, it is so hard because there really aren't very clear protocols for treatment. And so we ran into that a lot with Theo, where one doctor would feel we should do this and another doctor felt we should do this. And it kind of lands on the patient and the caregiver to make decisions that you almost want the doctor to tell you what is right, and there is no right. So it's a really challenging place, but it sounds like palliative could help you think that through and get to a better decision by, again, going back to what you care about most and what means the most to you. Although this conversation is mainly about providing comfort and support, we do get questions about hospice. So I'd like to touch on it a little because, Grant, I loved how you described it when we spoke earlier, and we get questions about it. So I'd like you to just share what hospice is and how you know when you might be ready for hospice, especially when it comes to LMD.
Yeah, such a great question. And I think it's really helpful to think of hospice as an even more specialized form of palliative care. So, I think it's helpful to think of all hospice is palliative care, but not all of palliative care is hospice. As I hope you're taking away, we can see people at any age, any stage of an illness, help with symptom management, figuring out the right treatment plan and kind of goals of care. Hospice is a form of palliative care that really is focused on that kind of final stage of life. And, I think that it often is a really good fit for people when the number one goal for the individual and the family is to make sure that someone's as comfortable as possible and that they feel strongly enough about that comfort value that doing things to prolong life can kind of take a back seat. Um, a lot of people, when they enroll in hospice, they're at a place where they want to be comfortable, both in their physical symptoms, but also in their environment. So they're often at a place where, going back to the hospital for another CT scan or lab draws and more procedures, they feel like the burdens of those things are greater than the potential benefits. And I think when someone is in that condition and that's where their mind is at, that hospice can be really a great support, continuing to help people live as well as possible for as long as possible, but really focusing on that quality of life piece.
That's really helpful. I think, again, as we said before, palliative care scares people, hospice scares people. I do think we need a rebranding campaign around palliative to make it, easier for people to understand and really know what it involves. Alex, a question we've heard before, and this kind of like bridges between palliative and hospice, but someone asked, I'm not sure if my mom fully understands her diagnosis. How should I talk to her about her diagnosis and prognosis? Is that something I should tell her what's going on if she doesn't understand? And I think that comes up with a lot with LMD because there's, definitely issues with understanding and memory and cognitive impairment that could happen for some people with
Yeah,
LMD.
this is a great question to discuss with your palliative care provider, because this is another situation where it depends. But what we can start with is asking the question, how much information do you want? Some people want to cope by focusing on the positive and letting other people be involved in making the decisions and just doing what is needed. And so I think it starts with finding out how they want that information. Now, if it's a situation where the person is not cognitively intact, they don't understand, not because they're trying to sort of cope with being in a place of denial, but they just really can't remember, then it often can be, and this is a discussion you can have with your palliative team, right? It can often be a discussion about what they would have wanted or how they approached information when they were able to be fully involved in decision making. And that might be before they were even diagnosed, but it still is what can lead you to making those decisions if you are the person that is tasked with being the decision maker at that time. So that's how I think we always start with what we're trying to do, what's in the best interest of the patient and what they would want for themselves. Open to, if anyone else has anything to add to that, please jump in.
I really agree with what you said there, Alex, and I think that kind of the palliative care team and the medical team can maybe help with some more formal assessments of how well can this person hold on to the information that they're getting and sort of help think through, like, does it make sense to keep on trying to get this information to be held on to? Or is that something that, we're just at a place where that's not something that we should reasonably expect, and it might be reasonable to kind of let that piece go, but still can respect their desire for information and help navigate that.
Megan, one question we did get, and I think someone was curious about how long ago Larry was diagnosed and how long did he survive? How long was he in palliative care? And did he then move into hospice? What did that look like, his journey, if you don't mind sharing that?
Certainly. So my Larry was diagnosed with stage 4 lung cancer when he was about 65. And he passed away when he was 77. So he had a very long journey. However, there was a lot of bumps along the way, and especially at the end. I was very close with his thoracic oncology or lung cancer team, because I was kind of, as a caregiver / somebody that works in the field, I was kind of the go-to medical liaison. However, my father-in-law definitely directed exactly what he wanted the entire time. But I got a phone call from one of the nurse practitioners saying, I'm worried about Larry's scan. And I had been watching kind of some of these symptoms kind of show up, mostly a big increase in fatigue and just some confusion for him, like eyesight changes. And so I was like, okay. So we got went in for the lumbar puncture, and of course, being Larry, he was like, I'm fine. I don't, everything's great. It's just another bump in the road. I'll get over. And then I got a call from the provider letting me know that, this is, the results came back and it is extremely positive for LMD, and it's the weekend, and how should I broach this with your father-in-law, knowing that he likes everything to be positive, and how and when. So we kind of talked about that, and I was like, let's give it the weekend and wait until Monday, and then from there, things progressed really quickly. We tried to get him on a new medication, but that was hard just with approvals, insurance authorization. And during that time, we just watching him go from having all of a sudden use a walker to a wheelchair, um, just lots of vomiting and pain, and we were just needing all of this help. And so, calling the providers and the nurses, and I was like, look, I can't keep calling every hour, all hours of the days. It's time to go to hospice, unless we want to go to the emergency room for supportive care. But we knew that's not what he wanted. He wanted to be at home. And so he was still very resistant at that time. And so we said, look, we're going to bring him in. They're going to come meet you. We want everybody to be safe, because he was very high risk for falls at that point, trying to get up to the bathroom, not, eating, not drinking, and kind of having these high pressure episodes. And I was like, hospice can really help us manage this care. And then we reached out to thoracic oncology, who called him after he went to hospice on the weekend. And he said, Larry, this is the right thing to do. It's you have fought very, very hard. And which he did. But unfortunately, probably from time of LMD diagnosis to hospice to his death was probably 3 weeks. So it was very quick, but we knew what he wanted. And so we just, kind of leaned in to each other, and the team and support from kind of all angles, and went from there.
Thank you for sharing that. I mean, I know that's, always a really hard part of everything that we talk about here. And I'm glad he had the palliative care and the hospice care to support him. And one of the things I've heard from all the doctors that I've talked to about this is they always say, like, if you've seen one case of LMD, you've seen one case of LMD, meaning that everybody's so different. So some people have very fast progression. Some people are here years later. Some people are not seeing symptoms. Some people have significant symptoms. And I think that's part of the challenge with understanding LMD, understanding the pathway people are on, and also understanding, like, it's hard to really compare or talk to other people about what they've been through. Even though it's helpful, it doesn't mean you're going to have the same path. So that is where I think having the support of a team can really help you, because you don't know if you'll be dealing with this for years and trying to stay strong for years, or if it's going to be fast. So really finding the support early so that it can help you through that journey. We only have a few minutes left. Grant, before we end, I just wanted to quickly ask, since LMD affects people of all ages and people around the world, can you just quickly tell us if palliative and hospice care works the same as adults as it does for children? And then are these kind of services available outside of the US and other parts of the world?
Yeah, great question. And I would say that palliative care is a growing and evolving field. It has grown enormously over the last 1 to 2 decades. So growing, I would say pediatric palliative care similarly is growing and more available, especially spreading and growing into outpatient spaces. A lot of hospitals have palliative care teams, and we're really seeing rapid expansion outpatient, which is great. That means more access to services. What we've talked about today has really been what we would call specialty palliative care, which is kind of the gold standard of palliative care, that holistic, multi-team member, integrated team. And, outside of the US, palliative care takes different forms. Sometimes it's much more community-based or based on like a community health worker providing some of the support, but maybe not all the supports that we talked about. And it probably tracks a bit with kind of like income level of country. So in like high income countries, there's kind of better and more robust palliative care that's more like what we're talking about today. And in probably some of like the low middle income countries, there still could be palliative care and some resources, but probably like a little bit more limited and may not be kind of like a full robust team. So I'm not an expert in this area, but that's at least my general gestalt about sort of palliative care globally and across the US.
That's really helpful. I think people can definitely talk to their healthcare providers, their oncologists, their hospitals, look into it. We also, there was a great website that you mentioned. I'll make sure it's in our on our website and in our follow-up information that can help you access palliative care around the US. And we'll look for more resources for other people around the world. Um, I know this is not an easy conversation. The words are difficult, the discussion's difficult, but we all do need support to improve our quality of life when living with leptomeningeal. And I think putting into words how it's affecting your life and what matters to you most can really help ensure that you and your team are on the same page and that um, your medical team understands what you want and how to guide your care in a way that truly fits your needs. So I think this was really a good discussion. I hope it was helpful to all of you who are on this call. Um, we have 2 webinars coming up in the next 2 months, so please sign up for our newsletter on our website. If you follow us on social media, you'll get updates. And if you have any feedback, please email me with any thoughts or questions. We're always open to your input, to your feedback, so we can keep improving and providing the information that you need. So thank you to our speakers, to our producer, and to all of you on this call tonight. And thank you. Have a good evening.